Good afternoon, everyone. We are the group number 6, and we are going to report research entitled The Effects of COVID-19 on the Emotional Aspects of Nurses. I'm requesting to open your ears and minds and listen for our report this afternoon. And thank you.
Abstract. Currently, there is a global pandemic of COVID-19 that is causing great strain on our health workers around the world. This study aims to discover what are the effects of the pandemic on the emotional aspect of nurses in Zamboanga City, Philippines. The researchers used an interview for their research tool. The results show that there is a change in the emotional aspects of the nurses, especially in their daily routines pre-pandemic. Fear and worry of COVID-19 is universal among nurses. The emotional health of every health worker should be addressed seriously, and the factors behind this should also be assessed.
Background of the study. COVID-19 pandemic is the crisis we are facing today. We are suffering this pandemic due to the spread of virus that had great impact to the people worldwide, and especially for our frontliners, including the nurses. As Gawadra Abdullah Chu and Pang 2019 says, nursing for COVID-19 patients was high-risk work, and any mistake in the process might lead to serious consequences such as transmission of the novel coronavirus from patients to others in the hospital or disease condition, deterioration of the COVID-19 patients. Thus, it was important for nurses working in frontline to make to maintain a good physical health as well as psychological health. For a long time, the physical health of nurses has been paid more attention, but the psychological health was usually neglected.
Statement of the problem. This study determines how COVID-19 pandemic can affect the emotional aspects of the nurses. The first one is, what are the effects of the COVID-19 to the emotional state of nurses? Second, what are the emotional consequences that nurses experience during COVID-19? And the last one, what are the emotional coping strategies of nurses in the effects of COVID-19 pandemic? The main purpose of this study is to determine how the COVID-19 pandemic has affected the emotional aspect or state of nurses.
So we'll tackle about the methodology. First, the research design. It says that the researchers used case study method. This study interviewed two nurses in a random hospitals in Zamboanga City about the effects of COVID-19 pandemic to the emotional aspects of them. Second, research instrument. Questions was used as an instrument of the study to examine how COVID-19 pandemic affect the emotional aspect of the nurses. Third, research subjects. The subjects of the study are nurses. There are No age, range, and specific positions as a nurse, just nurses in random hospitals in Zamboanga City. Research local. This study was conducted in Zamboanga City. The last one is the sampling method. This study used purposive sampling method where the researchers choose subject for the specific person for this research.
For the results and discussion, for the results and conclusion, COVID-19 gives a big difference and challenges to nurses. They have to deal with the changes of this new normal. This may be to their uniforms. Before they can have just their scrub suits or whatever, but now they have to use their face mask, face shield, and also the PPEs. And they have limited interaction to people, and they are being new to it, and also to their trainings. Before they can do their actual training, but now they are using our technology for their trainings. But still, despite of the difficulties, differences, and changes of our new normal, COVID-19 has also a positive side to their life in their lives, giving care, comfort, and service, and in general gives them satisfaction. And this COVID-19 reminds us to be prepared in every situation that will come into our lives, into the community, that just like this pandemic that happened unexpectedly and not being prepared of it.
Thank you so much for listening to our report this afternoon. And we will show you a video, interview video of two nurses that we interviewed and their answers to the effects of the COVID-19 to them. The link of that video will be posted on the description box. Thank you so much and good afternoon.